It's one of the world's most contagious diseases, and it can kill. We thought we had it under control, even eradicated in some countries. So why is measles back and spreading? This is Inside Story. Hello and welcome to the programme. I'm Martine Dennis. Now, infectious diseases that were once considered under control are making a comeback. The World Health Organization, the WHO, is raising the alarm about a sharp rise in measles cases across the world, but particularly in developed countries. Now, one of the reasons is that more parents are choosing not to immunise their children. The WHO lists vaccine scepticism as one of the 10 biggest threats to public health. The United States is currently struggling to contain several measles outbreaks. And in Washington state, which has at least 50 cases, anti-vaccination campaigners are gaining strength. And doctors say this is putting lives at risk.
Measles is really scary because it is so contagious. If a person with measles is in a room with 10 other people who are unvaccinated, 9 of them will get measles. It's also frightening because somebody can transmit measles 4 days before they have the rash. That means they can transmit it even before they know that they're infectious.
All right, let's have a closer look at some of the figures then coming from the UN. The reported number of measles cases globally nearly doubled last year, up from just over 115,000 in 2017 to almost 230,000. Well, the increase has been reported in all parts of the world. In the Americas, almost 17,000 people were infected in 2018. And just 2 months into this year, and already almost 300 people have the disease in the United States alone. And although Europe saw a record number of people vaccinated against measles, the number of those with the virus in 2018 was the highest in a decade. All right, let's introduce our guests now. In London, we have Dr. Heidi Larson, who's director of the Vaccine Confidence Project. That's a research group based at the London School of Hygiene and Tropical Medicine. In Nairobi, Kenya, we have Dr. Peter Borus, who's head of the measles programme and senior scientist at the Kenya Medical Research Institute. Welcome to you both. Heidi, let me start with you, though. What is the driver, the main driver, between this alarming set of statistics that we've received from the UN?
Well, I think there's no one main driver, and that's part of the challenge. We do see, as you mentioned earlier, a dramatic 83,000 cases of measles are across Europe alone. And there we know that it's not education, it's not income, it's less likely to be access. So there we think we see that there's more choice to refuse a vaccine. In other parts of the world, it's probably a mix of more infrastructure, people on the move. It's quite a mix of issues.
Right.
But it's converging into quite a drama.
Absolutely. All right, Peter, in Nairobi, then, presumably, therefore, there is less access, perhaps less information about the benefits of immunisation, of vaccination. Is that what is behind the rise in measles on the African continent?
It's a combination of various issues. At the end of the day, what drives measles outbreaks is immunity gaps, meaning children are not accessing vaccines the way they are meant to. And the main issue here is some programmatic failures.
What does that mean? What does that mean?
Programmatic failures means that for children to access vaccines, the vaccination or immunization program needs to deliver vaccines to the children that need. If you look at the issues of access, that is one issue that has to be addressed in this particular setting. The issues of community acceptance to vaccinations is another issue. And the issues of actual availability of commodities is another issue, which touches on financing of vaccines when they are required to be administered.
Right. And Heidi, obviously the picture in the developed world is very different, as you've already made mention of. Particularly in Europe, there is, though, a certain discrepancy, isn't there, between those countries that are perhaps better off and those that are, say, middle income. There is some difference, isn't there, between these two groups of countries?
Yeah, well, I think it's less of an economic issue and more of a political issue. I mean, certain countries, in Italy, it's very much entwined with populism. In Ukraine, which has some of the highest in the European region, it's a mix of historic gaps, because this isn't all babies who are being not getting their vaccines and having measles. We see teenagers and young adults, even some young parents with children having died because they missed their vaccine. 15, 20 years ago, when there was the scare about the connection between, for instance, MMR and autism, which has since been debunked, there was an anxiety. And so there are some kids who missed their vaccine and now are teenagers and young adults. And sometimes there were stockouts, political transitions, as in Eastern Europe. And these things catch up, and measles is the quickest to see where the gaps are.
Right. And Peter, presumably in Africa, you've also got the added negative element of conflict in many parts of the continent, which of course will disrupt any kinds of programs of immunisation. Plus, you've got to have something like 95% of the population fully immunised in order to be able to prevent the outbreak of a disease like measles.
Yes, that's right. That's right. In Africa, definitely the issues of civil strife or conflict compound the already weak programs that we have in the continent. In countries that are struggling with conflicts and humanitarian disasters, definitely it exacerbates the situation that is already delicate. If you look at countries that are more stable and more economically vibrant, the issues really would have to do with the gaps that programs or the immunization programs within the ministries of health or ministries of social services, whatever the setting is, have to contend with. Like, if you look at like the case for this country I'm in, like Kenya, we have had a campaign, a mass campaign, basically targeting susceptible children within a particular birth cohort in 2016. And measles cases dropped drastically. In fact, the confirmed cases at some point over a period of close to half a year, there were only 2 cases which were confirmed in laboratories, which of course tells you that we've got interventions that work.
Right.
But subsequently, if you looked at now the situation between them in 2016 and 2018, because of the various issues that we just indicated of access, of the infrastructure and resources just to push these vaccines to where they are needed, we've had literally an explosion of cases across counties.
Right.
Well, so it's a very important thing. And part of the counties that are struggling actually are these counties with nomadic populations, counties that have insecurity issues. So yes, conflict is an issue that exacerbates the problem of measles.
And given that measles kills around 2 of every 1,000 children that get infected, this is a very serious problem indeed. Heidi, coming to you, I want to ask you a bit more about this vaccine hesitancy, this scepticism that has arisen that we're very aware of in parts of Europe and indeed parts of the United States that is working against so much of the progress that was made in the years up until 2017, I believe, when there was a really good rate of overall vaccination, immunisation, which has suddenly started to tail off and reverse?
Well, I think some of it is a bit of hubris that we know better, and it's because we're not seeing, thanks to the success of immunization, we're seeing less virus, so less measles, less cases. And so the drama and the motivation to take a vaccine when you see the impact of it has waned a bit. Not everywhere, but in some cases. In other cases, there is a growing back to nature movement, wanting to have natural foods, some believing that actually it's better for a child to be exposed by the measles itself rather than a vaccine, which is absolutely not true. It's just putting the child at much more risk than they are if they get vaccinated. So it's this mix of things where they feel kind of liberated from facing the disease itself, and some of them have safety concerns and are still wondering about links with developmental diseases, autism, which have been proven again and again not to be linked.
Heidi, let me draw your attention and our audience's attention to one particular anti-vaccine campaigner who's attracted quite a lot of attention. Her name is Darla Shine. She's the wife of the White House Deputy Communications Director, and in 2 tweets on Wednesday, she said, "I had the measles, mumps, chickenpox as a child, and so did every kid I knew. Sadly, my kids had the vaccine, MMR, so they will never have the lifelong natural immunity that I have. The entire baby boom population alive today had the measles as kids." And then she ends, "Bring back our childhood diseases. They keep you healthy and they fight cancer." Now, Heidi, I would imagine that Darla Shine doesn't have a huge amount of medical training, but I would also imagine that that kind of approach out there on social media is highly damaging.
It is highly damaging, and actually, I've also had all of those childhood diseases that you mentioned because there weren't vaccines for those illnesses then. I feel very lucky. She's focusing on the people who did survive vaccines, but she's not paying attention to the large number of deaths and disabling illnesses that happened for other children during that time. But I've heard that also. I've even seen appeals for chickenpox parties, measles parties, and a book called Melanie's Marvelous Measles about embracing your illness. What's interesting to me is actually the principle of what they're talking about is correct, but because that's what vaccines do, is give you a very slight exposure to build your immunity, but they do it in a much safer way than actually be exposing to the live virus.
Right, and Peter in Nairobi, is that something you recognise as well on the continent? I know that in parts of the continent, like for instance in northern Nigeria, where there was a grassroots move against vaccination for polio, and that led to a spike in the incidence of the disease again, and it was based upon basically suspicion and lack of trust.
Yeah, the issues here, the social issues, the social resistance is an issue, but not as damaging as in other places. We have groups. We have particularly religious groups within the continent that do not support immunization campaigns, and particularly for polio and other mass campaigns. But if you look at the way governments have responded to these particular engagements with the hesitancy groups, over the years it has yielded fruit. The thing is to really talk to these groups who organized groups that like year in Kenya, we had concerns raised by the Catholic Church, and government had to really go out of its way to engage this particular group, to allay their fears and engage them in a productive and positive way.
And has that been successful? Has that been successful, Peter?
It was successful. At least we ended up getting a situation where we came up with mechanisms to address the concerns of the church, and the church basically wanted the issues on vaccine safety, on whether there are impurities and so on. So government had to come and tackle those issues and give an added layer of assurance that the vaccines are safe, they're effective, and there are no contaminants, basically.
Right. Now, Heidi, let's go back to the situation in the United States, because it's incredibly illuminating as to the nature of the problem that all of you in your profession are having to deal with at the moment. Measles had been eliminated in the United States by the year 2000, I understand. Now in Washington State, it seems as though you've got a battle royal on between those who don't want their children to be immunised and those who feel that it should be mandatory. So there's a bit of a battle when it comes to legislation going on. But the end result is that you do have a high incidence of measles as a disease being endured by the population of Washington State. How typical, would you say, is the situation in this state on the west coast of the United States?
Well, it's certainly critical. And I think that we've seen these debates in other states, particularly in California, and the parents who want vaccination use the opportunity of the Disneyland outbreak of measles that happened there as an occasion to say enough is enough. We want vaccines to be required, and they lobbied to remove what they call personal belief or philosophical exemptions. And we've seen this in a number of settings, is sometimes it takes an outbreak that enrages some of the parents who actually believe in vaccines, and they feel like enough, and they get mobilized to try to deal with it legislatively. But then it's really embedded in some of the populist spirit we see in politics. It's not unlike that. But I think the important thing is these occasions can actually mobilize positive moves to get legislation in place. And I'm not a big believer in mandates per se, but I think when you're dealing with a highly infectious illness and talking about school environments, hospitals, and places where people gather and can be highly infectious, I think sometimes there's a place for them.
Well, because Peter, I'm assuming that it is much more beneficial, much more preferable, should we say, for you to get your immunity from measles by having the vaccination or the 2 doses of vaccination which is required, rather than having to go through the disease itself.
Absolutely. If you look at even the groups that are against vaccine, and what you quoted as somebody who sort of looks at the issues of having natural infection versus vaccine, you wouldn't want really to have a child go through the pain and what really entails getting measles disease and other diseases which are vaccine preventable, when you actually have the tools and the vaccines that can protect. I think the part of the Western world, basically, some of the conversation are driven by successes, as the previous speakers just said. It's driven by part of the successes of immunization in this country. So if you've not seen measles in a generation and so on, and you tend to basically take a lot of things for granted.
Right.
For for some of us who are brought in this setting and who see some of these cases and the suffering these cases cause, I would not want a child really to have an infection when it can be prevented.
Right. Now, Heidi, I'm rather intrigued by the organisation that you work for. It's the State of Vaccine Confidence is the name of your outfit, and that is, of course, having to address head-on the issue of trust. I'm thinking there's a particular case in the Philippines at the moment where there is, I think, a crisis of trust in vaccinations generally because of a scandal attached to one. That's now having a very negative effect on the rate and spread of measles in the Philippines.
Yes, that's correct. Our research group, the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine, we have been monitoring globally these issues. This is for 10 years now because we saw it emerging in different settings. And one of the things we saw about the breakdown in trust and confidence is that we need to understand what's driving it because it happens for different reasons in different places. And we developed what we call a vaccine confidence index that we've been running globally and in certain settings. And in the case of the Philippines was part of our global confidence index study in 2016. And when we saw the outrage by the public following the announcement that the new dengue vaccine has a slight risk of more serious illness if you've never been exposed to dengue before. And it became very politicized, the current, against the previous government that had approved such a vaccine, but that was without the new information. And when we saw how it became a real, very fired up public outrage and additionally broke the trust with the system and people started refusing measles vaccines. There's huge measles outbreaks now, and also even deworming medicine because of the breakdown in trust with the health system. We went in and did a confidence index survey again, and the public trust has dropped from over 90% to 20%. And that's the basis. And now that we have, and the ministry has some numbers on it, that becomes something they can work against to rebuild trust and to understand how they can rebuild it. And starting with measles is actually really important.
And Peter, in Nairobi, presumably tackling public misinformation is a crucial part of your work in terms of maximising the take-up rate of immunisation.
Absolutely. The key issues that we tackle, and I think all countries should have this, we have risk communication as a very important element in terms of program management. If you look at whenever there are incidents of adverse reactions, because there are bound to be some reactions, particularly when you administer vaccines in mass, there has to be that risk communication element built into programs so that when and as any event occurs, the public can be reassured about, the issues, and basically confidence can be built in the program. We've got a very robust system now in place to, whenever we have any adverse event, whenever there are rumors to do with safety issues on vaccines, we handle them very quickly.
Right.
And the Ministry of Health really goes and handles it. So
Right.
I'd say the issue of risk communication is very, very key in program management.
Thank you all very much indeed. Dr. Peter Borus talking to us live from Nairobi, the Kenyan capital. Dr. Heidi Larson, Director of the Vaccine Confidence Project, talking to us live from London. Thank you both very much indeed. And as ever, thank you for watching the programme. You can see it again anytime you like. You can go to the website, aljazeera.com. Now, if you have an opinion, want to ask some questions, remember you can go to our Facebook page. That's facebook.com/AJ Inside Story. And there's a Twitter sphere, @AJ Inside Story. I'm @Martine Dennis. From the whole team here in Doha. It's bye for now.